The next presenter is Lauren Rowe from PHC, and she'll tell us more about.
Good afternoon, everyone. I don't think you can see me over the computer. My name is Laura Rowe. I'm the Chief Operating Officer at Project Healthy Children. Project Healthy Children is a nonprofit organization based just across the river in Cambridge. And we work with developing country governments to give them technical assistance in the area of large-scale food fortification programming. So the goal of my brief talk this afternoon is to first tell you about who we are and what we do, and then go into a little bit of the areas of the challenges that we face in food fortification programming, how we address them, and then touch upon one area of innovation specifically around small-scale fortification that we're working in. So before I move forward, I thought it would be a good idea if I defined large-scale food fortification versus small-scale for those not working in it. The image on your left is a picture of a small flour mill in a village. So that's when I say small-scale fortification, I'm referring to fortifying flour that comes out of that device. They're called hammer mills or poaching mills. They're found in rural areas. Women will bring a bag of grain. It gets poured into the hopper on the top, that rectangular or square piece. It gets ground up. And so historically, trying to fortify at this level has been really difficult because of human error. It's not mechanized, and so adding vitamins and minerals at that level can be really difficult. And I'll talk about what we're doing in that area. When I say large-scale food fortification, it's this large flour mill or cooking oil facility that produces upwards of 50 to 100 metric tons a day. Small scale would be more like 1 to 2 metric tons a day. So we have current programs in Rwanda, Malawi, Burundi, Liberia, Sierra Leone, and Zimbabwe. We have a completed program in Honduras. So those are our large-scale fortification programs. We have completed a small-scale fortification pilot in Nepal and are currently running a program in Tanzania. And the way in which we operate is we place individuals in service of governments in these countries. So we have one country coordinator who sits side by side with the Ministry of Health or equivalent in each of these countries to provide them with technical assistance. The idea is that we have as little of a presence as possible to ensure that we are handing over the program to the government after 3 to 5 years. So again, we sit side by side, kind of like consultants with these governments in the design of the program. We use what we call a rigorous data-driven approach when we go into a country. So first of all, we only go to countries that invite us to come because having political commitment to these programs is absolutely essential. Without it, from the top, middle, bottom, it's not going to be an effective program. So after we're asked to come, we do a situation assessment. We look at food consumption patterns, so this might mean actually conducting a food consumption survey or piggybacking onto already existing surveys like HIES or the CFSNS studies to understand current food consumption patterns. We look at current micronutrient deficiencies. We do market analyses to understand pricing to ensure that fortification isn't going to increase the price of the staple food products. And we do an industry analysis. So that's looking at how consolidated is the maize flour or wheat flour industry or the cooking oil or sugar or salt industry, depending on what staple is being produced. And so we work in these 4 puzzle pieces or buckets. And these buckets aren't really anything new to anybody in the room that works in food fortification, but it's a really nice way of structuring our model of operating and then communicating that to the government to ensure that they can drive the program forward. So the first is enabling nutrition policy and legislation. So that's ensuring that food fortification is actually written into already existing nutrition strategies and policies. It's ensuring that food fortification is mandatory. For large scale, that's really essential to allow a level playing field for industry. We then draft food fortification standards that are consistent with the food consumption patterns of that specific population, while at the same time being harmonized with any regional fortification standards that may exist to preclude any barriers to trade. We then work with industry to ensure they understand where to get the equipment that they need to bring in the premix that they need, the vitamins and minerals to add, where they need to add the new equipment on their process line. And then finally, we work with social marketing and government regulation. And really, the government regulation piece should be flashing. That is arguably the most important piece to any food fortification program, and it is almost consistently the piece that's overlooked in a program. A lot of times you'll see these maps come out that show the countries in blue that have fortification programs that are in place, and really it's the first three puzzle pieces. They don't have the last fourth puzzle piece in place, and so those programs don't ensure that the adequately fortified food product is actually reaching the target population. And I'll get into that a little bit later. So just stepping back a little bit, a lot of people ask, why does Project Healthy Children only work in food fortification? One is we're very small. We knew we wanted to impact micronutrient deficiencies, and so we had to pick one intervention to work in. Food fortification really gave us the biggest bang for our buck. And I'm not going to spend too much time on this slide. The point of it is to show that food fortification can be very powerful. And this data up here is just looking at the impact on neural tube defects through folic acid fortification. And really, it's quite powerful to see the impact. Chile is a great program that I always like to mention. Chile's fortification program would only need to prevent 2 neural tube defects to recoup more than the annual cost of the program. So it's really an impressive program, and it has to be tailored to the country in order to have this impact. Something we don't see is we don't have a nice table like this for iron fortification. It's really hard, and this is a big gap in the fortification world. It's really hard to find really good impact studies showing a decrease in iron deficiency anemia. Just this month, actually, a nice study came out on the impact of Costa Rica's flour fortification program, which showed some really impressive declines in iron deficiency anemia. So that should be added to this slide. But this is really just to show the incredible impact that it could have. Despite that evidence, though, you will oftentimes not see food fortification written into national agendas. And it's really because it can get very, very messy. Project Healthy Children has been in existence since 2000, and so after studying the experiences that we have had and then looking at programs that have succeeded in the past and that have failed in the past, what we were really able to tease out is that there's a lot of elements in the seams of these puzzle pieces that are absolutely essential for a program to work. And we've kind of distilled it down into 6 different core elements that fall within the seams that aren't so tangible as legislation or policy or standards. And it's things like greater government commitment. What I was talking about before, you can't go and start one of these programs in a country that's only kind of halfway there with it. You need their total buy-in, because for a fortification program to have an impact on the nutrition status of the population, it has to be owned by the government. And so they need to be bought in from the very beginning. Assistance that's given needs to be really tailored to the context that it's being provided. So that's really understanding what foods is this country actually consuming the most of in terms of staple food products. How are they consuming them? What segments of the population? What are their deficiency rates? So that the program can be tailored for the country. Focus on institutional in-country capacity building. This kind of goes back to the political buy-in. You've got to have that there for a fortification program to be successful. Private sector engagement from the get-go. Zambia actually is a great example of this. Zambia did not involve their industry in the beginning when they started their fortification program, and it took almost 10 years to get it off the ground because of that. So getting private sector involved in the beginning is really, really important. Government monitoring before impact studies occur. So this is getting back to that last puzzle piece. Really ensuring that we're looking at the elements that go into a program's design and ensuring they work before we wait 5 years to look at whether it had an impact on the nutritional status. Because what we find is when you have the 3 puzzle pieces in place and you walk away before the 4th one is done, you find that industry may not actually be putting in the right amount of nutrients in the get-go. Maybe the standard was wrong based on how much of the nutrient is lost on the market. So there's all of these kind of management by exception, I like to think of it as pieces that need to be looked at in order to ensure it's going to have the impact. Better choice of fortificants. This is really why we aren't seeing a strong impact. One of the reasons we're not seeing a strong impact of iron fortification programs, because there's historically been a very poor choice in fortificant form. And then, of course, a better choice of metrics and impact indicators. I'm not going to go into all the different strategies that we've used to try to get around these. There's one I want to touch on briefly, and that's a monitoring tool that we're working with countries to use in order to address this lack of government monitoring, to ensure the program inputs are being accurately put together. So we've come up with, what we've found in these countries is that the data is lost. If it is at all collected in the beginning, the data is lost. And what I mean by data is inspectors going to industries, going to markets, going to households, going to border points, and bringing back samples so that we understand, we can test it and understand whether the right amount is added. So that data is often lost. It's handed off to different agencies because you've got ministry and health involved in one and commerce in another, et cetera, et cetera. So we've designed this kind of single platform data capture form that looks at how many samples are brought in and what the standard is after it's tested. This is an example of one of the graphs the tool can generate. It's average salt iodization level by custom station. The tool can generate by company, by brand, by quarter. So it's a really nice way of aggregating the data, and it creates graphs, which is a very powerful way of then going back to an alliance, a fortification alliance, or an industry, or a decision-making body and saying, we have a problem here. With the whole goal of ensuring that we have more fortification programs that are going to impact the nutritional status of the population. Moving quickly past large-scale fortification programming into small-scale. So large-scale is great for those who eat centrally processed foods, but really in a lot of countries, the vast majority of the most vulnerable are not consuming centrally processed foods. They're consuming flour from the small mill. And there have been a lot of attempts in the past to do something about this, to ensure that food coming out of those hammer mills is fortified. But they've really fallen short from a technological perspective and from a business model perspective. So in the past 6 years, we have worked with different engineers at Stanford University to come up with a device that's completely automated, that sits on top of the hopper, the square piece of a hammer mill, and dispense premix based on a pre-programmed amount. And instead of talking about this, I'd like to show you just a 1-minute video, if I can. Great.
The first of its kind, fully automated nutrient dosifier designed specifically for small-scale fortification. It's lighter than a sack of flour, yet robust enough to handle the harsh environment and continuous operating hours of rural production mills. It can be installed and operational in literally minutes and has the capacity to fortify over 1 metric ton of flour per hour. The device attaches seamlessly, requiring no modifications to existing equipment or any additional steps. The miller simply fills the weight-sensitive grain hopper and adds the concentrated nutrient premix. Loss of weight technology utilizes 4 load sensors. According to the set dose threshold, the sensors activate a motor-driven feed screw to precisely dispense the nutrient premix directly into the outflow of the grain in proportion to the loss of weight, producing fortified flour. And we invite you to learn more at sanco.com.
Okay. So that's from the technological standpoint. I'm happy to talk to anybody afterwards, kind of more about it. From the business model standpoint, we've put together what we hope is going to be an effective business model. We're partnering with USAID currently in Tanzania. In February, we're going to have 57 devices in the field. And the business model, and the reason why we want a business model is we want to move this out of the realm of development and donor funding, really. It will probably work in some cases, not in others. But where we think it's going to work best is we've come up with, we've established a partnership with a premix supplier, a company out of Germany, and they're willing to purchase the device from us and provide it free to millers or to donor agencies, whoever wants it, with the assumption that that donor agency or that miller will then buy the premix from their company. And after running the numbers, they will recoup the costs from buying the device if this enormous market of small-scale mills then buys premix from them. So we're going to try it for the first time in Tanzania in February. So this is 3 regions in Tanzania that we're rolling it out in. There's 7 currently operational right now. We're going to add 50 to that and hopefully scale up to 200 in 2016. And the goal is that by March 2017, that this could potentially actually be a sustainable business model. So we will see. So from the large-scale food fortification programming perspective, we're looking for other country programs out there that exist now. They're having serious issues with the monitoring piece of it because we'd really like to help countries collate their data and put it into some sort of a single platform data capture tool, and this tool can be adapted to any country setting that will allow them to track compliance and take action where there is no compliance. And then from the small scale perspective, we're thrilled to be working with the Global Public Health Center to test the impact of Senku. We're going to be doing that at some point. Thanks to Makaya for our potential collaboration there. And we're seeking any other people or organizations where small scale milling is a dominant practice in high burden areas. We think it could have a powerful impact. And again, we'll have real data hopefully after February to show you. So thank you very much.